1.4 million people live with epilepsy in the United States. November is National Epilepsy Awareness Month, dedicated to providing support for those coping with epilepsy and sharing knowledge on what it means to experience seizures. Joining us today to talk about the challenges for people with epilepsy is Dr. Gabriel Martz, director of the Epilepsy Center at Hartford Healthcare's Ayer Neuroscience Institute. Thanks so much for being with us, Doctor.
Thanks for having me. Happy to be here.
Yeah, can you tell us what exactly is epilepsy and what are the causes?
A lot of people find it confusing. Epilepsy means that for whatever reason, your brain is able to make seizures by itself. A seizure is, in a moment, someone has a seizure. It's a contained thing within a minute or so, usually. Whereas epilepsy is having seizures over time, not caused by something else.
So what are some of the challenges that those with epilepsy and who are living with it experience?
It causes a lot of problems. The seizures is the main symptom people think of, but when someone also has, in addition to seizures, may also have problems with learning, problems with thinking, they may have problems where they can't drive. When you add all that up, what you see as a group, people with epilepsy are less likely to get through high school and college, less likely to get married, less likely to have jobs. So it actually causes a lot of problems. And you asked before about causes. Sometimes the causes, may also cause those issues. So you combine, for example, having had a brain tumor or a stroke or some other problem, and on top of that having epilepsy, it can be really challenging.
Yeah. And on the hopeful side, what are the options when it comes to treatment?
Yeah, fortunately, most people with epilepsy can manage their seizures very well with medications. Some of the other issues we just talked about, with wraparound or comprehensive care like we offer at our center, we can also address insurance-related issues, learning issues, school issues, and get people really living their best quality of life. When medicines don't work, which sometimes happens, we have a variety of surgical treatments. Brain surgery can sound scary, but in some cases can actually cure people of epilepsy if they don't have seizures anymore. So we definitely think about that where it's an appropriate for a given person.
Doctor, thanks so much for teaching us a little bit more.
Yeah, my pleasure. Thank you for having me on.
And for more information, you can also visit hartfordhealthcare.org/epilepsy.